Classical Conditioning and Opiate Overdose Deaths. The article at Case Report Pavlovian Conditioning as a Risk Factor of Heroin Overdose Death, Genevieve et al. 2005, discusses classical conditioning, which means over time your body can become conditioned to the environment where you use the opiate drugs. Opiates, a very powerful drug, are given to people to relax them and slow down their breathing. At small doses, opiates take care of pain. As a person becomes dependent on a drug, they start using larger and larger amounts of the drugs to the point of addiction. As the body becomes addicted to the opiates over time, your body develops tolerance to the large amount of drugs entering the body. This means that when you go into the environment without the drugs, your body's chemistry is already preparing for the large doses of the drugs. Your body acts like Pavlovian's dog, who salivated without food being present, and is getting ready for a large number of opiates when you enter a room without drugs even being there. Therefore, to prepare, your heart rate increases and all your body functions are elevated for the anticipation of the large amount of drugs to enter your system. Your opiate receptors decrease during tolerance so that the larger amount of drugs can enter. You have tolerance in areas where you're familiar with taking the drug. So when you put large number of drugs into your system, in an environment where your body has not had time to prepare for the drugs to come and adjust your breathing rate goes too low, and this can be fatal. The person taking this large number of opiates overdoses and dies. Cue exposure therapy is therefore very important for a counselor to do with their client. In cue exposure therapy, you're gradually expose the conditioned stimulus and replace the drugs with something else, like opiate blocking drugs like naloxone or Pavlovian. If you repeat this over time, the stimulus becomes neutral and is no longer effective. The implications are that you have to be very careful and make sure you remind your patients that they always need to use the same environment while they are using or slowly withdrawing from the drugs. Any new environment can jolt the body and cause the person to go into shock or even die. Therefore, it is important as a therapist to recognize the cues or triggers that go with a person's addiction. The triggers might even be a person that they use the drugs with. It can also be a place where they use the drugs, or a sound, or a smell. It is also important to remember that every person may have different cues or triggers that cause them to respond to their addiction in a more powerful way. Therefore, it is important to know a patient's triggers for opiates. When talking to patients, you need to know in detail the specific setting where they use the opiates, and remind them the importance of being in this exact setting. Once you know these triggers, then you can use the cognitive behavior therapy and motivational therapies to reduce these triggers. Over time, while a person is in treatment, it is critical to reduce the number and power of these cues. However, this has to be done gradually. People who do not reduce these opiate addiction triggers are at risk for relapse. So it is important to know what they are and then use these triggers as a part of your treatment. I would first explain to my clients what they do to the body, that they slow down the breathing and heart rate. I would then tell my client that when they are using opiates, that they always use opiates in the same environment, even if their cravings is too strong and they are unable to control it. Hiding away and doing the drugs in another location will result in death. It is better to be open about your addiction than to put yourself in a dangerous situation where you will die. When they are withdrawing from opiates, having the same environment that they originally started using in becomes very important. If you inject opiates in the bedroom, then you must always inject opiates in the bedroom. You don't inject them in the living room or the bathroom. You have to do the opiates in the same place where you first started using. Everything has to be the same. Everything. This is because the body becomes used to the original environment and therefore prepares for the larger number of drugs. When you go to a new environment, the body is not prepared for the large number of drugs entering the body. The body is very shocked by the extreme amount of opiates. The large amount of opiates, your breathing rate goes down to dangerously low levels. As a result, you stop breathing. You stop breathing, you die. I would also show them the opium movie and breathing pictures on slowing down because it shows the body not getting enough air. Then to show them that opiate overdose is a common occurrence, I would tell them that in 2020, the Center for Disease Control and Prevention found that 36,500 overdose deaths in America were caused from taking opiates. I would also show them examples of people who took the drugs in different areas and overdosed. Because I could see a patient saying, "Oh well, that won't happen to me." And yes, it can and will if you do drugs in different environment with different people. The advice I can give is to use the same environment and social cues that you were using from the moment you began using the drugs. Under any circumstances, do not change your environment. Withdraw and use in the same environment. Opiates are taken to reduce pain and lower your heart rate. Over time, once your body becomes tolerant to the large number of opiates going into your system, then when you go into that environment where you took the drugs, your body is already preparing and increasing your heart rate and increased breathing rate for the injection. In a different place, your body would not be prepared to when you took the drugs. It would cause your breathing rate and heart rate to go too low, and overdose and death is imminent. If you use in your home, then you need to withdraw from your home and use in the same home so as not to put your body into toxic shock. Never use the drugs in another location, but in the same environment. As a professional, we have a great responsibility to make sure we always alert our patients to the dangers of conditioning. The other advice I would give is that it is essential as counselors to work with our patients to reduce these triggers. By doing this continuously over time, patients will be able to reduce their cravings in an environment where they once used opiates in large amounts. If patients know what triggers cause them to feel cravings of drugs, then they will be better able to manage their cravings and their addiction. It will take a long time of classical reconditioning and opium blocking medications to retrain the brain, but it can and must be done to help stop people from overdosing and dying from taking opiates. Now I'm going to tell you my references. Here's my references. My references was Alien Medical Media, October 30th, Opiates, Mechanisms of Action and Tolerance, the Centers for Disease Control and Prevention, Davis M. What Causes Opiate Addiction and Why Is It Tough to Combat, Genevieve et al., a case report of Pavlovian conditioning as a risk factor for heroin overdose and death, Hoverell, classical conditioning and addiction in the center site, McComb, episode 10, Pavlovian's dog relating to addiction recovery works, McKellen, drug-induced conditioning and preferences for substance abuse disorder research, NIDA, prescription opiate drug facts, Nova PBS official, the science of a doping addiction, Cidio, Pavlovian conditioning and heroin overdose, and the final one, Her, classical conditioning to the drug addiction. Thank you for this presentation. I hope you have a great day.